Hi, and welcome to today's webinar. My name is Shane Grivich. I'm the Chief Strategy Officer and co-founder here at ChartSpan Medical Technologies. And with me is our Director of Quality, Jennifer Towers. And today we're going to talk to you a little bit about the hidden value of CCM, or chronic care management, specifically for FQHCs. Just to briefly touch on the CCM program, as it's under the value-based care umbrella, it's really designed to move into the preventative patient care journey. So simply put, the CCM program is designed to help patients and providers engage more effectively in between their office visits. The CCM program is designed for patients that have been diagnosed with 2 or more chronic conditions. They had to have been seen by the rendering CCM provider in the last 12 months. And if you'll provide 20 minutes or more of coordinated care, you can bill the G0511 code once every 30 days and reimburse roughly $65 for the code each time you bill it. That being said, though, we really wanted to spend the bulk of our time here today was really kind of diving into some of the specifics, value add that maybe some of you aren't thinking about that run FQHCs. And so, Jennifer, I'd like to hand it off to you here. Can you talk a little bit about how the spending works, the grant money that comes in, and how potentially CCM can help with these processes?
Right. Thanks, Shane. FQHCs, I know you have to budget for how you're going to use your grant money. And in my opinion, I see ChartSpan being a service line item under your Section 330 grants, falling under quality or technology, or your community center health fund, falling under those service line items of expand services and reach more patients. As you can imagine, we are expanding your services by offering chronic care management. We're able to reach more patients with this program. We will help improve your quality scores by addressing open gaps in care. And you can also use our technology of our CCM program.
So essentially, really what you could do is almost utilize revenue, some of the grant money that you're getting, to produce new revenue and outcomes for your patients.
Yeah, FQs are in a very unique situation. You know, you're going to be able to spend your grant money to add an additional revenue stream for your clinic.
Excellent. One of the other things that we wanted to dive into as well was thinking about the quality improvement award badges. These are things that, various enhancers and various things that I know that many of the here in the audience are thinking about or currently have, or other certifications that they're looking to achieve. Walk us through a little bit about how you think CCM potentially could support these various enhancers and PCMH. All
right. So I think CCM could support our advancing health information technology for quality, for advancing telehealth patient engagement. Your CCM calls will be done over the phone. We will collect social determinants of health information. We are improving and increasing access to care and quality of care. For our value enhancer, it has been shown that patients enrolled in the CCM program have lower costs than those that are not enrolled in the CCM program. For our access enhancers, we're also going to hopefully increase the number of patients services that are being offered, and then the access to those comprehensive services. And we're also going to support you in your PCMH recognition.
Go to our next slide here.
All right, so PCMH for NCQA has 6 main concepts. That's team-based care and practice organization, knowing and managing your patients, patient-centered access and continuity, care management and support, care coordination and care transitions, and performance measurement and quality improvement. So ChartSpan can support you in your recognition programs. For these 6 main concepts, our CCM program offers your patients access to care 24/7. We assist in addressing open quality measures. And as mentioned before, our CCM program has been shown that our patients have lower costs than those that are not enrolled.
So essentially, if I'm listening carefully, what you're saying is that by running a CCM program, it really does support the hallmark, or really the foundational elements of PCMH.
Yeah, those that are familiar with the NCQA PCMH know that we have core criteria and elective credits that we have to meet, and some of our processes that are already in place will help you meet those requirements.
Very good. Something else we wanted to touch on, which is a nice segue, which supports the initiatives that Jennifer was just talking about, was how is CCM specifically impacting patients at their level, and how does that translate over to your quality measure reporting? ChartSpan is the first company in the United States that has invested in access to claims data down to the patient level. And so what we've been able to do is extrapolate data points out of the actual data from the Part A, Part B, and Part D data points, and identify how effective is the CCM program specifically for FQHCs. We wanted just to share a little bit of this data that we began to review. So this is an FQHC, it's a system in Central Ohio. And what we did is we took a CCM cohort of patients that were active in the program over a 12-month period, and we compared them to patients that had similar comorbidities that were not enrolled in the CCM program at the same practice, and really to have a nice apples to apples comparison. So in this slide here, what we wanted to illustrate was two data points that we found interesting. First was the claim count per patient. So with the CCM enrolled patients, we actually had a higher number of claims per patient. And really, we believe that that's really indicative of being able to get the patients more involved with the providers, get in for more of their office visits, identifying opportunities for gaps in cares that need to be closed. So it was higher than the patients that were not enrolled in the actual CCM program. But look at to the right, what's really interesting to us is the average cost per patient. So the total cost of care average for both cohorts was significantly lower for the patients that were enrolled in the CCM program. So even though there were more office visits, more claims that were counted, there actually was on an average of $1,800 lower for the total cost of care for the patients that were in the program versus those that were not enrolled. Another data point we wanted to review was the inpatient cost, this Part A claim. So when patients do have an acute event or they are admitted to the hospital, what is the average cost? And interestingly enough, CCM patients, similarly to the last slide, had a significant decrease in the overall cost. It was 20% lower, or on average $444 cheaper for the patients that were enrolled in the program, not enrolled but eligible. Lastly, we wanted to look at the pharma costs, and this is really a direct impact to the patients' is out-of-pocket costs. If you look at the CCM enrolled, again, the claims per patient was higher, and again, we're getting the patients more involved, making sure that their prescriptions are being refilled, identifying when they need to get in for services, make sure that they're having access to those medications when needed. So it's significantly higher than those that were not enrolled. But again, look at the cost per patient. On average, it was $1,500 less in Part D costs for the patients that were enrolled in the program versus those not enrolled. And that's a significant impact to the out-of-pocket cost of the patients within this study. So we really appreciate everybody's time. Jennifer, thank you for your time and expertise today. And if you have any other questions or if you'd like additional information, please come visit us on the link here on your slide below. Thank you very much.
Thank you.